Are you a nose breather? Or are you a mouth breather? Sometimes we can be both. We just need to identify it, and that way we can figure out where we're at and the importance of nose breathing and not mouth breathing. Welcome back, guys. My name is Becky Moore. I'm with Restart Hygiene. I'm a dental hygienist here that loves to talk about teeth, gums, and airway. So, mouth breathing can be very detrimental to your health, especially for your children, and they are a lot of times undiagnosed. So, we want to make sure that we bring you all the knowledge that I can to help you and your family be healthier and making sure that you're nose breathing and not mouth breathing. So, what is mouth breathing? It's just a habitual habit to breathe through your mouth versus your nose. Now, many people breathe through their mouth during the day. I see them do it. And so, likely, if you're breathing through your mouth in the daytime, you're breathing through your mouth at nighttime. This can greatly affect the way that your body works. You want to make sure that your body gets enough oxygen, that your vessels are opened up so they can receive nutrients and oxygen throughout the body. And when you have a reduced amount of nitric oxide in the body, that can certainly alter those. And we're going to talk about more about that here shortly. So let's talk about, first of all, the causes. Why do you breathe through your nose or mouth? Possibly. Okay, first, if you can't breathe through your nose, then you're going to breathe through your mouth. So if you have an obstruction in your nose, if you have sinuses or any kind of obstruction, you're definitely not going to be able to breathe through your nose. And that way your body starts breathing through the mouth because you have to have a certain amount of oxygen, and the body will find a way to get what it needs. Number two, certain habits. So sleeping with your mouth consistently open just tends to keep building on that. Like I said, if you do it in the daytime, you're likely doing it at night. And once you're in the habit, it's hard to break that habit until you identify it and start making changes, which hopefully after today you can start doing that. Third is facial anatomy. So structural abnormalities happen. If your tonsils or adenoids are large, then you're blocking your nasal airway, so you're going to have to breathe through your mouth. And that is a cause of that as well. So make sure that you identify if you have enlarged adenoids or tonsils. That can help you. And then tongue posture. That's one where I can help you. Having correct tongue posture, where your tongue rests, where your teeth rest, and your lips rest, can really make a big difference in overcoming mouth breathing and getting back to the natural way, which is as nose breathing. So, problems associated with mouth breathing, dental issues. If you mouth breathe and you don't nose breathe, your teeth will be more decayed. Though you'll have more gum disease and gingivitis because your mouth cannot, your tissues or your body cannot make enough saliva to lubricate your tissues, lubricate your teeth, and keep those cavity free or disease free. That's important. Facial development. Children who mouth breathe have a lot more malocclusion, so their teeth don't fit together right. Their faces grow long. They have dark circles under their eyes. They have attention troubles in school, so they're not able to sit still in school. They drool. They even sleepwalk and wet their bed. So mouth breathing can be a big issue for children, and please be aware of that and check your children to see if they're having that. Sleep disruption. So if you're breathing through your mouth, you're likely going to snore because your tongue pops back in the back of your throat, blocks your airway, so you snore. You have apnea issues too, so that is another contributor to mouth breathing and the effect of it. Respiratory problems. Your nose is meant to clean the air that comes in. It's got little hairs in there. It's got humidity in there. It's moist. So your nose is meant to filter this air, humidify it so that when it goes into your body's able to use it to make the nitric oxide that you need and oxygen that you need. So it's important that you do nose breathe for that case as well. Nitric oxide is a big factor. We want to make sure that you get enough nitric oxide from oxygenated blood because you want to make sure that your vessels stay dilated. You want to make sure that your body's able to get enough nutrients and oxygen throughout. If they are constricted, when you don't have enough nitric oxide, that can, of course, can cause heart disease and kidney issues, lung disease, even erectile dysfunction. So very big deal that you don't even really think about. So all right, so remedies. How can I remedy if I have a mouth breathing issue? How can I remedy it? My first thought as a hygienist is to teach my patients correct tongue posture. So if you're ready to learn that, I can show it to you right now. Here it goes. All right, so you want to put your tongue at the roof of your mouth right behind your front teeth. So there's little groovy spots on your palate right behind your front teeth. Put your tongue there. Close your teeth all the way down. Now open them slightly. Close your lips together. So tongue at the roof, teeth slightly apart, lips together. That is correct tongue posture. Can you do that when you're driving? Can you do that when you're watching TV? Can you do that when you go to sleep at night? Can you do that when you're not eating, talking, or chewing? Basically. So majority of your 24 hours a day should be with your tongue at the roof, teeth slightly apart, lips together. Okay, next. And you can retrain yourself. I've done it. So I know it's easy to say, but I have tried to do that. And it is muscle memory. Your tongue will start going where it's supposed to go once you retrain it. So good luck with that. Next thing is nasal hygiene. Clean your sinuses out. Make sure that there's no obstructions there so that you are able, when you lay back, to breathe through your nose, if that's an option for you. So a saline solution, xylitol was my pick, but that can also help you as well. Allergy management. If you know you have allergies, take your allergy medication. So that will help it keep everything dried up. But remember, the allergy medicines a lot of times can cause dry mouth, which is also an issue with the mouth breathings as well. Breathing exercises, the diaphragmatic instructions you can learn to breathe. I don't know a lot about those at this time, so I can't educate you on that, but you can look that up and see if that's something that can help you as well as breathing exercises. Orthodontic intervention. Your orthodontist can be your child's best friend and yours as well, because if they get your teeth in the right position, your tongue is going to naturally want to go in the right position as well. So a lot of times it's just a cause and effect kind of situation. The body changes and then things don't go where they're supposed to go. And then medical intervention. If you see your doctor, he says you have large adenoids or tonsils and they need to be removed, and that's blocking your airway, then please see if that's something that can help you, because that oxygen, not getting enough oxygen, not getting enough nitric oxide, will affect you the longer that you live and walk this earth. So, all right. So remember, mouth breathing is a habit that can be changed. I have done it. I did not realize that my tongue would not go in the right spot and that I was mouth breathing. So common signs of mouth breathing is drooling, I wrote those down, snoring, bad breath, more disease processes, and large tonsils and adenoids. So those are some signs and symptoms for you to look for that you definitely have some mouth breathing going on. Doesn't have to be necessarily at night. It can be in the daytime. So I hope this helps. Remember, tongue posture is important. Breathing exercises, keeping your nasal passages clean, and look at your children. See what they're doing. You could really make a difference in their lives for whole body health as well. My name is Becky Moore with Restart Hygiene. If you like this, please subscribe and like this channel. I'm growing and I'm having a blast and I'm loving to educate you guys. And I will be back with more useful information next time. Thank you so much.